Can you dive into specifically the neurofeedback that you're doing? So when I think about neurofeedback, I'm thinking that you're asked to perform a specific action, and then you actually get some measured tracing of what your brain is doing.
The whole point is you learn how your brain, just like riding a bicycle, your brain learns through a protocolized neurofeedback by getting into a certain state of learning. It's like you can make neurofeedback harder or easier based on the feedback that the brain states are giving you. So if the goal is to, for example, get a ball through a hole in a gamified neurofeedback video game, and you do that too easily, they can make it so your cognitive load is a little harder to get the ball through the hole. So that's what's really interesting about it, is like your brain is actually both subconsciously and consciously needing content and wanting to learn at all times.
Dr. Vookshoor, long time coming for you to be on this podcast. We've been trying forever. For like a year.
That's right.
I'm so glad you got out of the operating room for a little while to join me.
Thank you so much, Darshan. It's an honor and pleasure to be here. I'm so proud of what you've done with Next Health, and just super excited to finally get together and talk about things that we're both very interested in.
Yeah, I know. So for the listeners, Dr. Vookshoor is a highly, highly accomplished neurosurgeon. Going through residency and fellowship, I always had such tremendous respect for the neurosurgeons because you understand the brain at such an incredibly high level. Not only is neurology inherent in your training, neurosurgery, where you're operating on the brain, really gives you an anatomical perspective on the brain that almost no one gets, right? And so you've turned that knowledge also into a deeper understanding of not just how the brain functions, but also why it functions the way it does and what other aspects of life and our brain physiology that we're not talking about. And there's so much interesting content here that I think our audience is going to love, but also I'm excited to dive in with you because I haven't talked about any of this on the podcast yet. So thank you for joining us.
Of course. No, I thank you for that introduction. It's, I wish my wife would hear that. She should think more highly of me. I do think that, we've never looked at brain as in the correct context. And I think we've just been in silos, and that's just the way science and medicine work.
Yeah.
And so I've constantly wanted to blend multiple disciplines, very similar to what you have done as a plastic surgeon.
Yeah.
I think you realized that there was something lacking and in medical care, and you filled it very nicely. Everything from executive physicals to getting the correct labs to trying sort of frontier technology. And we're basically doing that with cognitive health. So I'm a spine surgeon. I'm a practicing neurosurgeon that does 90% spine surgery. And I noticed from very early on in training that our outcomes in spine surgery are not as clear as they should be. So you cannot guarantee someone an 80 to 95% rate of success. And the factors that go into why the outcomes are not clear are quite varied. Some of them are physiologic, some of them are anatomic because the spine is a complicated 66 joint structure. And finally, some are psychologic. So I just realized that, okay, the blend of the nervous system of psychology, physiology, anatomy needs a home, needs a place. And that's what I really am jazzed about and want to talk to you about. And I think, you're an example of what is possible as we go through the next frontier of health in trying to, use biohacking techniques, but also stay on the side of evidence and stay on the side of, well, this is the strength of evidence for this particular therapy. You may change it a few months from now. You may modify it. You may optimize it. And that's what I love. And that's what I want to do for brain health, because there's no health without brain health.
Yes, exactly. So let me bring in some of these concepts here that you talked about. I recognized as a surgeon a long time ago that almost everyone I was doing surgery on was unhealthy, right? And from a physiological standpoint, right? Maybe they had metabolic disease, maybe they had some level of cardiovascular disease, hypertension, et cetera. And all the things that we talk about here in Next Health, measuring the biomarkers, reversing the chronic disease, actually help prevent patients from getting surgery as well. But, I've always intuitively thought that all of this could apply to the brain as well. We just don't do it. And so you kind of
don't do it.
We just don't do it at all. We live in society that we think, life sucks. We get depressed. We need an antidepressant.
Right.
Or we think, my mom had Alzheimer's disease, so I'm probably going to get it too. So
Right.
It is what it is,
Right.
And I mean, correct me if I'm wrong, but I feel like both of those are so misguided. Even pain, like I have pain, I need surgery. It's like a knee-jerk reaction.
Exactly.
And I need, Vicodin or pain pills. And all of these are just so misguided.
I think you're spot on. I think we've had these rituals of I have this, therefore I need this pill, or I have this, therefore I need this surgery. And Western medicine is blamed for that. And I think people like you and I are trying to do a little bit of a combination of, now we do have, enhanced recovery optimization protocols. They're finally filtering in, but deep look at physiology, especially the nervous system physiology, is still lacking because it is a little bit of a mysterious place.
Yeah.
We're just learning about the glymphatic system.
Yeah.
We've learned about the mind-gut connection more and more now, and how important the microbiome is in your mood and emotional setting, et cetera. So all those things are really interesting. To take a word from Dr. Attia, who talks about the 4 horsemen, my 4 horsemen for the nervous system which are going to be in epidemic proportions, unfortunately, are dementia, chronic pain, depression, as well as everyday anxiety and stress that we're constantly dealing with.
So those are the 4 horsemen that the brain is subject to deterioration from.
Exactly. And the everyday micro trauma, you can have macro trauma, which is, like traumatic brain injury, but the micro trauma that happens through everyday life is also really interesting. And some of that is because of the poor physiologic health and poor nutrition, et cetera. So all of that really play a part into it.
Oh, interesting.
Yeah.
Let's dive into each one of those 4 horsemen, if you don't mind.
No, absolutely.
Where would you like to start? Maybe chronic pain is a great place
I think
to
that's
start.
the one I deal with the most. Obviously, I'm not a dementia expert. Those are usually neurologists, but I work with some of the best-in-class neurologists. And in chronic pain, some of the best methods is realizing that, if someone has chronic back pain, for example, to treat it like a spinal anatomical condition is going to lead to unnecessary surgery. But to treat it as a brain and spine disorder, as a psychological disorder, as a physiological disorder, is the only way to actually get the patient better, possibly with surgery. But you're right, possibly they can avoid surgery if their brain wellness gets biohacked in a way that the pain is under reasonable control and they're living reasonable lives. You can sometimes avoid surgery. So that's the goal for a chronic pain patient and me, is to make a diagnosis. Is this mostly physiological or psychological, or is it anatomical? A lot of times people come to me with an obvious anatomical problem. So then that makes it a little easier, because then we can set the surgery up as a reset ceremony. So the surgical event is a reset ceremony. It's a controlled trauma under controlled physiology, and we can use that to change the axis of their lives. And that's been what I've been working on, to try to sort of use surgery as this ritualistic ceremony to change the axis of someone's life. But also addressing the physiology and the psychology of it.
And how do you tackle the physiology and the psychology of it?
So you do a lot of physiologic work at Next Health, for example. So hormonal support, bone health, like with DEXA scans, nerve health with nerve conduction studies, or there's neurography or other things, supplementation when reasonable, and paying attention to lifestyle factors such as exercise and sleep. So those are the big ones for physiology. I think nutrition, exercise, and sleep and also what their pain, where their pain is coming from anatomically, and are there psychological pain points as well? Because they also interfere with physiology to some direction. If someone is on chronic opioids, they have a different physiology than the average person.
What are some of the psychological reasons that people are dealing with more pain than they should be? When you say psychology is part of the problem, are there any specific conditions you're looking for?
So many people don't have a specific condition,
Okay.
but we know general anxiety disorder and everyday stress or dealing with lots of psychosocial stress are the biggest, most common factors.
Got it.
I've had patients, and this is so common in my practice now, where they've had a successful operation, their sciatica went away, their arm pain went away, and they would come back with some recurrence of the same nerve pain in a limb. And then I would dig deeper and like say, what else is going on? And talk about their psychosocial support structure. And invariably, there is either a reason for grief, there's a loss, there's a divorce, there's a bad financial situation. And that's what got me really interested in this concept of body budgeting. So how does the nervous system budget its available energy? The same exoplasmic flow, if you will, that makes you think and makes you have cognitive function and enjoy life is the same sort of physiologic substrate that gives energy to the nerves of the body. So if we think about that, we don't know how different bodies budget their nervous system energy. And a lot of times in those chronic pain patients that suffer with a psychological component, my biohack is, I'm not going to diagnose you like a psychiatrist because that's not my, I just want you better. So all I want to do is biohack into their body budgeting. And that's where I think we're very similar in like using biohacking tools that then reset that body budget so the nervous system can get better electricity, chemistry, and it can unlearn bad habits and it can learn better habits and hopefully reduce pain. That's our goal. That's our goal at the Neurovella Brain Spa.
Yeah. And so that was my next question to you. So how do you biohack that system? And you have a brain spa, which you created to help augment your practice, it sounds like. But now it's probably just kind of taken on a life of its own too, right? Like
Indeed.
You were like trying to solve pain for patients and you knew this was part of the puzzle, right?
Right.
But now it is part of the puzzle, but it also has other uses and other reasons that people go to the Neurovella Brain Spa.
Indeed. Thanks for asking.
Yeah.
So Neurovella started as a part of our practice to decrease anxiety and stress in people that were having perioperative anxiety. And many of our patients, if you tell someone they need back surgery, it's not a fun day in their life. Yeah. So we have to consider how do we truly carry them through this journey, through this marathon. And that's why I said surgery as a ritualistic reset is something that we've been doing. But everything from meditative breath work to vibroacoustic chairs to virtual reality and neurofeedback are used at the Brain Spa to reset that mindset. And it works. I mean, I've been incredibly proud of what our staff has been able to do with some patients that are very challenging. And then patients keep coming back for months after to deal with their anxiety and other issues, even after the surgery is long healed. So it's very interesting. That's why it's taken a life of its own. And I hope that we can address some of the problem of the four horsemen with the methods that are going on the Brain Spa. For example, I know you guys have a new TMS.
Transcranial magnetic stimulation, yes.
So transcranial magnetic stimulation is one of the most, I would say, powerful, relatively non-invasive way. I mean, it can have a little bit of scalp sensation problems, but it's a non-invasive way of dealing with depression and headaches based on what is on label with FDA. Right. And then it has many other applications because it's now a non-invasive surgical tool that can hack into the networks of the brain. And the main network of the brain that deals with chronic pain, for example, is a salience network.
Okay.
So you have these nodes that are on, hyperactive, above what their normal use would be. So instead of those nodes relaxing in a relaxed state, they remain on. And that's one of the problems with chronic pain. That's why I would say it's a brain disease.
Yeah.
You can actually see it physiologically on functional MRIs.
Really?
Yeah.
So if someone has back pain, you're saying that certain neurons stay active all the time in the brain.
Indeed.
And transcranial magnetic stimulation can alleviate and reduce that.
Neuromodulate that.
Got it.
So neuromodulation through TMS, through things like spinal cord stimulation, through transcutaneous stimulators, TENS units, and some better ones that are coming out on the market, are going to modulate the nervous system pathways.
Wow.
Acupuncture.
Yeah.
I mean,
that's one way.
We have evidence that acupuncture works through a transcutaneous system of modifying the nervous system.
Wow.
So it's pretty fascinating.
Yeah, acupuncture I've always found very fascinating.
Yeah.
And there is actually science behind it, to your point, is how it interrupts certain nervous pathways, right?
Indeed.
As you, and they've figured this out in ancient Chinese culture, how to find those specific points where you can interrupt a nervous pathway.
Indeed.
Yeah.
Indeed.
It's incredible.
Incredible. So, I think I consider myself what we call an integrative neurosurgeon that wants to do the best possible thing for a patient, not just through surgery, but get them to the best place in their life as a result of when they need surgery for an anatomical problem.
Yeah. Can I ask you more about the Neurovella? Can you dive into specifically the neurofeedback that you're doing? You said there's some virtual reality, there's other things. So when I think about neurofeedback, I'm thinking that you're asked to perform a specific action, and then you actually get some measured tracing of what your brain is doing, sometimes through EEG,
Exactly.
et cetera. Is that what you're doing there?
Indeed.
Yeah, okay.
Indeed. So it's, basically your brain waves are representing a certain brain state.
And these are the electrical waves.
These are the electrical waves
Got
of the
it.
brain. You can go 32 channels. I think at least 19 channels. There's even a 4-channel device that's commercially available. We've used it all. We've actually used it all because sometimes people don't have time to sit there for 30 minutes and get a real analysis. So we've even used the 4-channel sometimes for some patients. But the whole point is, you learn how your brain, just like riding a bicycle, your brain learns through a protocolized neurofeedback by getting into a certain state of learning. And there's a lot of interesting neurophysiology about this. It's like you can make neurofeedback harder or easier based on the feedback that the brain states are giving you. So if the goal is to, for example, get a ball through a hole in a gamified neurofeedback video game, and you do that too easily, they can make it so your cognitive load is a little harder to get the ball through the hole. So that's what's really interesting about it, is like your brain is actually both subconsciously and consciously needing content and wanting to learn at all times. Neurofeedback simply capitalizes on that and says, hey, why don't you go down this road? And those brain states, as a result of a few sessions of neurofeedback, can then remain habituated toward a better state of health. And that to me is fascinating.
That is fascinating, right?
Everything in the brain is, electrochemical and experiential. And the experiential component is what I really want to talk to you about, because that still is a complete mystery to us, right?
Yes.
And you've talked to some great people on your podcast about this, but the fact that we cannot even know how ourselves are experiencing the exact reality that we are is indeed the most magical mystery of the nervous system.
It's so fascinating to me, this world of what we're experiencing and how those experiences are translated into our thoughts, and what are we not experiencing, what are we not converting into thoughts that we are experiencing, right? And so there's a lot of talk about how our brains are actually multidimensional and we're all experiencing many things at the same time. We're just translating what's in our dimension right now into the thoughts that we're having. And I don't know if you've read any of the latest kind of articles out there about how there's the microtubules in our brain are actually the one place outside of like a large a collision reactor like they have in Sweden, that we could actually
At CERN, you're right.
CERN, right? That we could actually experience quantum states in our brain.
I love that you brought that up because on top of our practice and Neurovella, we have a nonprofit research organization.
Oh, amazing!
Called INI. I think you may have known about it, but basically we do a lot of spine related research.
Yeah.
And then I came across that theory sometime about 2010, I want to say, where Sir Roger Penrose, and Stuart Hameroff came up with this orchestrated objective reality, better known as OR. And there's a lot of holes in the theory from my deeply mathematically inclined neuroscientists that will talk about it. But I gave it to all our young researchers. We actually have a UCLA chapter now for INI.
Amazing.
Big shout out to INI UCLA. Yeah. But they're basically undergraduate students. And I said, this is mandatory reading because how hard science is. And the science of consciousness, which is like a big no-no for many neuroscientists because they don't want to get into this rabbit hole. They just, want to do their work and do their experiments and go home. But I feel like they were brave enough to theorize that, the microtubules of the brain have so many billions of states of being that their states could correlate with our states of being. And it makes cytoskeletal sense, but I'm not going to say I am even qualified to opine on the quality of evidence for orchestrated objective reality, but I am so happy you brought it up.
I had to bring it up. So I think about it all the time, and you have Elon Musk saying that we live in a simulation. And
yep.
There's a lot of theories that could support that as well. And so I don't know. It's just a very interesting part of neuroscience research that is just fascinating.
And a life journey. If you think about your journey here, I think people don't want to really talk about death and I think fear of death is one of those really important parts of being human.
Right.
But I feel like we concentrate on the joy of life, and we should concentrate on the joy of life because it's absolute magic, and we've been given these faculties to experience this beauty. But it is finite, as far as we know. And I feel like, people like Elon really simplified experience instead of basking in the magic of it, which I love. I mean, I feel like we come in all types, and we have, we have people that like to reduce things, and we have people that like to complicate things and make it more expansile. And I feel like both of those minds are necessary for humanity to go forward, especially in this new day and age that we're dealing with.
Oh, for sure. Okay, so let's go back to the Four Horsemen. I know we went down a rabbit hole there.
Yes, I love the rabbit hole.
It was a good rabbit hole. Yes. Okay, so we talked about pain, and one of the tools that you use for pain is looking at it from a psychological, physiological, and neurological standpoint.
Right.
And treating back pain just with surgery, obviously, people really need to dive into using tools like neurofeedback, for example, and also physiological tools such as getting your vitamins optimized and your metabolic health optimized. All those things can come together to even avoid surgery.
Yes.
So I have a big picture summary. So did I miss anything there on pain?
No, I think first, it does help people to have an anatomist, a structuralist, a surgeon,
right.
To let them know whether something is terribly wrong,
right,
or not.
Absolutely.
Like I'm dealing with patients right now, like literally before I got on this podcast. Like they need a voice of reason to say because their body is giving them signals that something terrible is going on, and you have to make sense of that signal for them. Because if you this is what some of our colleagues get mistaken. They're like, oh, that's just in their head or something like that. But this is physiology.
Right.
This is psychology. This is a person whose life is severely affected.
Right.
So I feel like we do need to exercise extreme empathy when the anatomical correlates are not necessarily there, especially in spine. But it's a great day when someone does not need major spine surgery.
Right.
So I try to spin it that way. I say, we'll find out what your pain is from, but thankfully you may or may not benefit from surgery right now.
Yeah.
But many people have minor abnormalities that cause severe pain, and you have to explain that based on their body type, musculature, activities, loads, lifestyle. And that's where it gets even more interesting. And that's where physiology, I think optimizing physiology and hormonal health and support really comes into play. Physical exercise comes into play, sleep hygiene comes into play. And then ultimately the person's psychology and their habits. You need to engage that. And I think we do a really decent job now, but we haven't always. And I think things like Neurovella Brain Spa, things like Next Health, things that are like the frontier biohacking methods of what's going on with our state of health is going to be absolutely necessary because our healthcare system is very challenged. It's very fragmented, and people are not able to get these types of care regularly.
Yeah, absolutely. You said that one of the things that really stuck out to me, what you just said, is that people with pain, sometimes the anatomy doesn't correlate with the level of pain that they're experiencing.
Right.
And that's where all these other tools need to come into place.
Yes.
And I think, there's two aspects of this. Sometimes when you're a surgeon, some surgeons, not you, of course, when all you have is a hammer, the world is a nail, right? So you see even a minor anatomical abnormality, let's go to surgery.
Yep.
Because that's what you do, right? And then you have some neurologists that maybe see this major anatomical abnormality and they don't do anything about it except put people on pain medication. Maybe not even neurologists. Maybe they're pain management doctors.
Right.
They put them on chronic pain relieving opioids and other medications, right?
Indeed.
And so really neither one of those is the correct answer.
Indeed. You hit it right on the mark. And what we do need is better anatomical tools of diagnosing the pain. So there is like spectroscopy. There's CT scan with spectroscopy. Now there is MRI scan with spectroscopy that actually we're involved in a research protocol
What is spectroscopy?
So spectroscopy is basically what MRI was originally based on, which is the chemical signature of any part of the body that's being scanned. Any part that's undergoing this magnetic wave can be scanned for its chemical signature. So we used to use it for brain tumors to see whether the peak of the chemical choline, for example, is known in cells that are highly dividing. So if you have a high choline peak in MRI spectroscopy, you can presume that that's a more aggressive type of neoplasm or tumor that's dividing faster because it has a high choline peak.
Fascinating.
But yeah, all of MRI is actually a picture of that spectrum. That's what's interesting about it.
So you're using an MRI to actually see what chemical reactions are occurring to create higher choline levels.
And that's in a brain tumor.
In a brain tumor, right.
In the spine, for example, MRI spectroscopy is still somewhat investigational, but our research protocol looks for chemical signature of things like alanine around the disc to look and see if the chemical milieu of the disc is inflammatory in nature. So it actually picks up discs that may be painful in the future even.
Wow.
So it's really fascinating. So I feel like we need better anatomical tools.
Yes.
And we need a better one-stop physiologic shop. That's why I love your executive physical. And
that's what we do, right?
Yeah, it's like I feel like you need a one-stop shop to say, okay, I went from A to Z and checked everything.
Exactly.
And so it's not any of the known things that could be contributing to this abnormality.
Yeah.
Thyroid function.
Mold toxins, Lyme disease, right? There's so many metabolic health abnormalities. Like all of those need to be ruled off and checked off the list because they do contribute to pain. And even if you have symptomatic pain, massively increasing the symptoms, even if there is an anatomical issue.
I recently have a very nice gentleman who's really dear to me with severe Parkinson's disease that I have operated on and have had. And Parkinson's disease is very complicated to operate, especially when it's severe. He had an incredibly positive outcome with spine surgery. And this is like 5 years back. Very recently, he developed pain again. We scanned everything. And the anatomical abnormality that's in his spine does not correlate with the degree of pain. So I've been working with his neurologist, working with his entire healthcare team. And one of his, I think he had a longevity doctor recommend a peptide, a very certain peptide,
BPC 157.
Exactly.
Yep.
So he had one dose of that and the pain went away. And he texted me, I hope he's watching this.
Incredible.
He texted me and he said, you were right. And, because it looked like I'm refusing surgery for something that was, a disc problem. And I was like, listen, I've done this before. Listen to me, And what I want to say is back surgery has a terrible reputation because we haven't done our homework.
Yeah.
So I want to give it a good reputation again by doing it when it's absolutely needed.
Yeah.
So spine surgery, when absolutely needed, is a godsend.
Yeah.
And when the data doesn't give you that feeling that you're going to have 90% success rate, you should know why it's 90%, why it's not 90%.
Yeah.
And that's where that's really the take home message.
Yeah. Well, that's a powerful story. I'm so glad you told that because I think peptides need to become a part of the conversation for many physiological problems that we have because, peptides are not drugs. Peptides are natural biological signals that for some reason our biology is not producing anymore. GLP-1 is a perfect example of that. With an unhealthy gut, you don't make enough GLP-1, you get hungry all the time, and you gain a lot of weight. That's why these GLP-1s work very well. Insulin is a peptide. And, I think there's so many out there that we can now replicate and give to people that can be potentially very useful. BPC 157 is right up there as top 3 useful peptides, and we use it all the time.
Love it.
Yeah.
I love it. I love the way you put that. I think just to round that out, what I would like to add, and this is where I think people like you really are necessary, is to put together a strength of evidence grade, like I&I is doing that, of a grade 1 to 5 to anything that biohacks the nervous system.
Right.
Can we give it a strength of evidence from light therapy to acupuncture to neurofeedback to TMS? And if we can give it an accurate strength of evidence from 1 to 5, there's actually a great statistical tool, grade 1 to 5. And if we can use
What's it called?
It's a grading. It's a grade 1 to 5. Yeah, it's a grading system.
Yeah.
And we're trying to use that tool along with a couple of other tools. But it's difficult to apply them to subjective treatments.
Yeah.
And that's where I wanted to talk to you about the complicated mathematical tools that we can use to research subjective criteria. And that's where I think I&I is going to shine for our practice and hopefully many other practices, is to give some of these tools like peptides a strength of evidence for certain pathways. So certain pathways of treatment. I think that will help a lot.
Wow, that's really interesting. So you're developing a methodology to statistically evaluate treatment protocols, tools that we have based on the strength of evidence.
Let's say
1 through 5.
Yeah, let's say like neurofeedback has class 2 or 3 evidence for general anxiety disorder. That should be known, and clinicians and scientists can say, okay, that's what we have. That's the best we have right now. But it's always improving because we're going to investigate more. And I feel like we live in an age where information is just flooded. We're flooded with information. I mean, we could have this podcast for 13 hours and it wouldn't be enough for everything that we want. We would like to cover.
I know, right?
So I feel like we're flooded with information and we don't have a nice landing spot.
No, it's true.
We need a couple of landing spots, and I feel like science is on trial, medicine's on trial. The erosion of trust in some of the medical and scientific establishment is, I believe, erosive to society. So we need to take it back, and we need to stand on the side of data and truth and evidence.
Yeah, I fully agree with you. It's a crazy world we're living in right now, and it's interesting to see kind of how people are now getting analysis paralysis. There's too much information coming from all sorts of people talking on social media, and everyone has an equal soapbox. It doesn't matter if you're a PhD doctor like yourself with a research institute or, some
I know.
influencer that is
Really cute TikTok videos.
Exactly, with cute TikTok dance videos talking about, Parkinson's and spine pain. It's mind blowing what's out there right now.
It's fascinating.
Yeah.
I'm absolutely fascinated by it. But yesterday I was operating on a gentleman, and they asked what music we wanted in the operating room. I asked the patient, and the patient wanted this pop song it's a K-pop, Demon Hunters.
Oh yeah,
So because
we listen to that all day long, every day at our house. Yeah.
So it shows that it really infiltrates every aspect of society. And I am a fan of pop neuroscience and pop culture. I just feel like it should know its place.
Yeah.
And I feel like there's the misinformation that bleeds into things that people are really struggling to look for real answers is where it gets a little dangerous.
Yeah, absolutely.
And I wish there was a way of even putting a strength of evidence for people's claims on social media.
Yeah,
Because
exactly.
there's a lot out there.
It should be like automatic. This would be like Instagram should have like a little number 1 through 5
Right.
on every post, evaluating the strength of the claims made of that post.
I think that's the best job for ChatGPT to figure out.
I'm actually building a tool like that for WhatsApp right now because I moderate many WhatsApp channels on health and wellness, and creating a AI-enabled tool using a tool called Open Evidence to evaluate claims made that people are putting on WhatsApp chats, and so it works
Incredible.
really well. And yeah, I think with AI we're going to have much better control of the information that's being put out there, and giving people just something to think about before they believe the validity or the truth of any individual's post.
I would love to see that.
Yeah, I'll show it
I
to
would
you.
love to see that in action. That sounds very exciting.
Let's go back to one of the other horsemen, if you don't mind.
Yes.
So let's talk about neurodegenerative disease, Alzheimer's, Parkinson's being the two most common.
Yeah.
Both the rate of rise of both of these is dramatic right now.
Yes.
And I would just to hear your perspective of the world of neurodegenerative disease from your vantage point as a neurosurgeon.
Yeah, no, I was personally affected by it. The entire reason I formed I&I was because my father got Alzheimer's.
Oh, I'm so sorry to hear that.
And this was in 2009, and I was literally looking at just from an anatomical standpoint, looking at potholes in his white matter tracts. I was imagining them as we're getting brain scan stuff as well, and I was like, okay, the information just cannot travel to the right spots with high fidelity. So these wires that are myelinated at age 2 become our high fidelity highways for information through the brain. And as they get neurodegenerative disorders, there's potholes in those highways. And those potholes have been the target of billions of dollars of research called the amyloid hypothesis, which unfortunately just kind of maybe cleans up the potholes, but doesn't do anything for the information. So I felt like from very early on, I was like, oh, these pills are not going to work as well as they think they are. And we're still in that crux of figuring out whether, the amyloid hypothesis has any validity, but so far it just hasn't shown that. So, and we've spent billions of dollars.
Yeah.
We now have much better testing with p-tau, so we can now tell who's at risk.
And I just want to highlight that right now because I think a lot of people have not heard about p-tau 217 and amyloid ratio.
Yeah.
These are incredibly powerful biomarkers that just became available in the last year. Blood tests that we can check for basically the damage being done with Alzheimer's from the neurofibrillatory tangles and the amyloid deposits. So that's just the framing. Tell me a little bit more of
Thanks
the
for
science.
mentioning that. It's very important. So there are incredible diagnostic tools now, and I think it behooves all of us to know our risk if you're interested in that. But I don't think we have a way of completely curing or controlling the epidemic that's coming for dementia. So the best things we got are actually lifestyle biohacks, such as physical exercise and sleep, and then some of the new information with GLP-1s and some of the new information with peptides that I'm a huge enthusiast of, but I want to better see the strength of evidence before I can prescribe it. But I'm very excited about the evidence that we've seen so far.
Yeah.
What do you think about it?
So I think we definitely have gone from having nothing to having a lot of things in the last decade
Right.
for neurodegenerative disease in general. One of the things that we never had was a biomarker tracking system to see if we're headed that way. And so p-tau and amyloid is, just like you said, I think everyone should be getting these, especially if you're at risk for Alzheimer's disease. Say you have a family relative, or if you're an ApoE positive gene risk, I think it's a great tracking tool. And what I'm hopeful of, and the data still needs to come, is that we could actually use these biomarkers to see the efficacy of the lifestyle changes that we're making and see if it reduces the number or the number keeps going up, right?
Indeed.
Because if the number keeps going up, there's something else happening causing progression of this disease that we have not yet addressed.
Exactly.
And we need to go down the rabbit hole a little bit more.
Incredible. So I want to go back to what I call the MNESP. So mentation, nutrition, exercise, pain, which can be psychological or anatomical or physiological, and sleep.
I love
So
this.
those are the five
Yes.
lifestyle factors. And then it gets much deeper with nutrition and microbiome, for example. Parkinson's disease has definitely an intestinal relationship
Wow.
that is now being borne out through great science. So what do we do to biohack the microbiome early enough to prevent something like Parkinson's?
I mean, we just got to highlight that, right? Like, because people sometimes have this mindset that I got Alzheimer's or I got Parkinson's, like they got an infection of pneumonia or something. You don't just get it. This is something that's been developing over a long time. You get a diagnosis finally when you get a PET scan of your brain, or there's criteria to diagnosis. You get the diagnosis, but it's a spectrum that develops over decades, a lifetime sometimes, right?
It's hard to imagine it because you're in your 20s or 30s. You don't even think about it.
Yeah, you don't think I'm developing Alzheimer's,
Even
but you
40s
might
and
be.
50s, right.
Exactly, right.
Yep. Well,
Wow.
I'm up for my executive physical and my and the plasmapheresis. By the way, I wanted to bring that up and ask you some questions about it because I did want to do it, and I wanted to make sure I understand the side effects.
Sure.
And it'd be great to just have a quick synopsis of that.
Right.
So if you're a little sick or you have the flu or something like that, should you avoid it or should you?
Yeah,
Okay.
I would for sure.
Got
Just for the listeners, it's very good point to bring plasmapheresis up in this conversation because plasmapheresis has research around it. The AMBAR study, which shows that it can slow the rate of progression of Alzheimer's. And so why and how? Plasmapheresis is a tool that's been approved by the FDA since the 1970s, where it's basically a procedure where we hook you up to an IV, one in each arm. One IV is removing blood from one arm and putting it through a giant centrifuge machine that we call an apheresis machine. And then we put another IV in so we can return back the blood that we've taken out. But in that centrifuge, if you've ever seen like a PRP, which I'm sure you've seen,
Yes.
when you spin blood, it separates the plasma, which is the white stuff on top, to the red stuff on the bottom, which is your blood cells.
Right.
The red stuff on the bottom is what we're giving you back. The plasma is what we're removing and throwing away. And we throw away like a big 3-liter bag of plasma. Like when you have it done, you'll see you'll hold up a bag of plasma and it all goes in the trash can. And what's going in the trash can with your plasma is all of the circulating toxins, immune complexes, inflammatory factors are all living in your plasma. Your body's working overtime to get rid of all this stuff, but it can't because your kidneys and liver can only do so much, right? So when we use this machine to do it for you, it's like you get this massive reset in your biology.
I love that.
It's kind of like an oil change for your body. And this has been shown in research to modulate many of the factors of aging. It's been shown to slow the rate of Alzheimer's progression because the thought is that the reason Alzheimer's progresses, one of the reasons is probably being exposed to constant levels of toxins, inflammation, et cetera. And so we're doing a study right now tracking the p-tau and the amyloid ratios on patients undergoing plasmapheresis as well.
Incredible.
And that could be a game changer for people that have elevated p-tau and amyloid.
I can't wait.
yeah.
I'd love to be involved in that.
I would love for you to be.
Informationally.
Yeah,
And also, like, just to put another plug for one of our colleagues that's working on this problem is Paul Song, who's originally a radiation oncologist,
Okay.
is working on a natural killer cell infusion for Alzheimer's. And it
Incredible.
has some evidence, good evidence, and it has definitely worked in a few of the examples that I've seen. Now, how long that benefit of reversing the dementia and how sustained and for how many years, that hasn't been borne out yet, but wanted to give him a plug because he's doing incredible work. And I think the company is NK Gen, or Natural Killer Genetics, and it's very powerful, exciting new therapy for treatment of something that we've never been able to really treat.
Yeah. The work around natural killer cells is going to be game-changing, not just for Alzheimer's, but for cancer, for everything that our body is
I love it.
that we're suffering from. And just for the audience to know as well, like, the NK cell is a specific type of T cell.
Yep.
T cell being an immune cell. And one of the biggest reasons we age, we get any type of chronic disease, Alzheimer's being one of them, higher risks of infection, is because our immune system is not as robust as it used to be when we were a child. And so immune aging or immunosenescence is a big part of the problem. And having the ability to create new natural killer cell lines, T cell lines, is going to be a game changer for all of health and cancer treatment and Alzheimer's, all of it.
I love that you brought that up, because that reminds me of the only thing we haven't talked about, which is the glymphatic system. So with things as simple as breath work, things as biohacks as simple as deep breath work, and this is one of the things we're working on at the Brain Spa, you change the physiology of your spinal fluid. And your spinal fluid is one of the methods by which your lymphatics rinse your brain off. And you can think of sleep as well as lucid dreaming, which is something that we're also doing at the Brain Spa, even intermittent lucid dreaming. You get a rinse cycle for your nervous system, kind of like a washout. And
can you explain real quick, what is the glymphatic system? Sorry to interrupt you.
No, not at all.
Because I want to dive in deeper. But I think people
so basically, like the lymphatic drainage of the brain is through the microglia, and it has these tiny little channels that are between the blood vessels. They're called the Virchow-Robin spaces, and so they're basically these are tiny spaces in the brain in which spinal fluid is interacting with the bloodstream. That's where the brain gets its rinse, and that's why sleep, both deep sleep, REM sleep, and lucid dreaming, have beneficial effects, because that's when the brain is doing the hard work of purging all of its content, all of its data, and also getting washed. Physically washed.
Yeah.
It's a brainwashing.
It's why sleep is so important, because I saw this in a journal article where they did electron microscopy of the lymphatics, and they're basically like empty and closed off during the day, but when you sleep, they fill up and they light up. And then this is when, like to your point, your neurons and your cells in your brain are expelling the toxins that build up all day long inside of the neurons, because all physiological processes, create more toxins, right? And so those need to be eliminated at some point.
I love the way you put that.
Yeah, and that's where that happens.
And two more points on that.
Yeah.
They interact with the microbiome of the gut. They interact with the intestines through those lymphatic channels.
Really?
Yeah, so that's one of the anatomical correlates of the mind-gut connection.
So
and
the
they interact through the vagus nerve.
Yeah.
So we that's the electrical component, and that's the sort of the sludge mechanism, right? The physical component of clearing out the nervous system.
So is the microbiome actually sensing the lymphatic drainage as a signal from the brain and it reacting to it?
Great question. I mean, I think that's a fantastic question. I feel like the nerve cells in the gut are dealing with the vagus nerve.
Yes.
That's how they get their input.
Right.
But the microbiome is affecting what goes into the lymphatic system for the brain to be rinsed either more effectively or less effectively. So I feel
I
like it's
see.
more like a interaction of the mind, of the gut on the mind,
Yeah.
and vice versa, obviously. But I don't exactly know where those channels would be.
It's just interesting because, this mind-gut connection.
Yeah. And
First,
immune, so mind,
Yeah.
gut, immune connection, the term by one of our brilliant board members, Dr. Emmer Mayer from UCLA, who's recently written a book on this.
no.
It's fantastic. So the immune system, and also this has implications for something totally off topic, space travel, because in space, because of microgravity environments, because of difficulty or the changes in breathing patterns and sleep patterns, that system seems to be glitchy. It doesn't go as well. And one of the reasons we think that there is cognitive deficits in some astronauts that have been in space for a long time is the abnormality of how spinal fluid and lymphatics rinse the brain off. It's not well understood, but
So
it's
interesting.
implicated. It's definitely implicated.
Wow, that is so interesting.
Yeah.
I want to go back to breath work because, I think people look at breath work sometimes as woo-woo, but there's actual physiological, anatomical reasons it works. There's two. I've always known of the vagus nerve,
Right.
Which is the action of the vagus nerve is modulated by whether or not you take a deep breath. But this lymphatic system is new to me. And you're saying during breath work is when you actually create more flow through the lymphatic system?
I believe during lucid dreaming and deep sleep, your breath pattern, lots of volumes of spinal fluid changes because of the intrathoracic pressure, et cetera.
Wow.
So it increases the lymphatic rinse efficiency.
So interesting.
And you can do that consciously through deep breathing. So deep, and that's why the sympathovagal tone and the lymphatics are implicated in deep breath work. And I think that's why one of the best methods of just balancing your entire nervous system, you're centering yourself, is deep breathing. It has thousands of years of meditative practice, but it also has a very modern biohack component to it. We have so many methods now. We have the Marines box breathing with 4-4-4. We have the 4-7-8. We have many versions of it. The Wim Hof method. All of them have a place, and all of them work depending on what you're trying to get to. But mine is very simple. I tell my patients, post-surgical, pre-surgical, around the time of a medical event, to take 10 to 20 deep breaths every morning, and to make it a ritual. Make it your waking up ritual. Make it your going to sleep ritual. Off screen, no screens, no other things, and I believe it works by the lymphatic rinse that it provides.
So interesting. Okay, so let's do the protocol. Let's do the Dr. Amir Vookshoor breathwork protocol. Let's talk about it. So 20 deep breaths.
Yeah,
once
10
a
to
day,
20. Yeah.
10 to 20,
Yeah.
once a day, twice a day.
Ideally twice a day.
Ideally twice a day. And are you breathing through your nose, through your mouth?
If you can breathe through your nose, I would recommend it. If you cannot, it's okay to go through the mouth.
And is there a pattern or a speed to it?
So I'm always going for a relaxing reset. If you're trying to energize for a task, you want to have a higher pace.
Right. Fast,
and
like a Wim Hof type of.
Like a Wim Hof, like a faster intentionality to it. But I'm always going for a parasympathetic rest and digest and recover.
Me too.
Yeah. So for me, it's as long of an inhale as you can take it, which in me can be anywhere from 10 to 20 count, depending on the day, and hold it for at least 10 seconds, and as long of an exhale as you can do it, which for me is again 10 to 20 count.
Got it.
And then at the end of that, this comes from diving, surfing, breath training.
You're a big surfer, I know that.
Not a big surfer, yeah. It comes from that information. If you hold your breath at the end of that, the CO2, kind of alerts you, like you need to take a breath, you need to take a breath. You actually don't. And you're well oxygenated. It's just a reflex.
Yeah.
And playing with that reflex also has great health benefits.
Yeah.
And if you can control your mind in holding that last exhale out and the body is not getting any oxygen for at least a count of 30 seconds, Some people do it for 3 minutes. The world record is like 10 minutes or something.
Yeah.
So, I think that's a very interesting physiological biohack as well.
Yeah, that breath hold. Right,
breath
absolutely.
hold.
So, I mean, that covers all of it. The long inhale, the hold, the long exhale, the hold.
Exactly.
Right? I love that.
Exactly.
Yeah.
And it doesn't have to be a certain count, but my 6-year-old had a hard time going to sleep the other day, and I started talking to her about box breathing. And she's like, "What's box breathing?" And we did some Marine 4-4-4-4. She had a little bit of a funny hard time with it, and then she picked it up and went perfectly to sleep. So it works.
It absolutely works for people that are having sleep problems out there as well, to practice some box breathing at night. It can, before you know it, you're like asleep again.
Indeed.
Yeah, for sure. It works for adults and children. Exactly. Okay, we're only 2 horsemen into the 4 horsemen, so let's talk about depression.
And we haven't even started talking about psychedelics.
Oh my gosh, I'm going to bring you back for psychedelics for sure. Depression. Let's talk. Maybe you can weave in psychedelics to this conversation.
I think depression is first of all, it's a leading cause of disability in the world.
Absolutely, right.
So, and some of my patients say, "Dr. V, don't you think we should all be depressed?" So there is this sobering reality that humans have about what's going on in the world. Like, shouldn't we all be depressed? Like, if you're logical enough and you see your surroundings, the rational mind would be depressed.
Yeah, that's interesting.
So there's great studies on this, actually, on the happiness hack, about how the happy-go-lucky people actually suffer from irrational optimism.
Right.
Which I know both of us suffer from. And it's the irrational optimism that keeps you going rather than what is logical, which is to be somewhat depressed about the ongoings, the embracing the suck that we have to do on a daily basis.
Yeah. So, I mean, you can make, arguments that we do live in the most prosperous, safest, abundant time in humanity's existence. So, having more of a long time period view versus just what's happening right now this year compared to last year.
Love it.
There's a lot to be optimistic about.
There is, but the rate of depression and anxiety and stress are much higher that would be predicted by those factors.
Yeah, so true. I know it's out of control.
And some people blame social media. Yeah. Some people blame electrotoxicity with all the electrical waves around us and the EMF. And I do believe, again, from a strength of evidence standpoint, all I care about is how do I biohack to make the body budget a little better so depression doesn't act as a sinkhole in your nervous system, stealing your ability to experience joy.
That's well said, right?
Yeah. So that's the way I look at it. And I think TMS, antidepressants have their role. They're not my favorites because traditionally they have numbing effects or other effects, but sometimes absolutely necessary. We have all the other lifestyle factors like we talked about: sleep, exercise, mental centering, pain control. Those are like very important. And also, like, finding a root cause. A lot of my chronic pain patients have an anatomical reason to be depressed. Their body does not work as well. They don't get up as swiftly. They can't walk as swiftly. They can't enjoy the things that give them joy.
Sure.
So that how do we biohack around that is our job. And that I think is the biggest challenge. But I think there is a way. I mean, I think we're doing a great job right now. First, getting to the root cause of it and staring right at it, engaging it as opposed to ignoring it.
Yep.
And second, saying what part of this can be biohacked psychologically, physiologically, or anatomically through a spine surgery or a joint replacement or something of that sort.
Yeah, absolutely. One tool that is so easy but so ignored in the treatment of depression is taking a look at the physiological reasons you might be depressed. There's so many people that have just vitamin D levels, I've seen this, less than 10. like they just don't have enough nutrients. They have a mold problem that they've been dealing with that they did not know of, and we find this in a mold toxicity test.
Wow.
They have metabolic health issues, like their hemoglobin A1C is through the roof and they never knew it, contributing to depression as well. So and those things are relatively easy to discover just with a full biomarker blood panel.
Incredible.
So if anyone out there is listening is depressed,
Yes.
do not just reactively take an antidepressant. Like, get everything checked. Get your physiology checked. And it's almost guaranteed that you'll find something, and then treating that thing will be potentially very helpful and reduce your need for medications. To your point, like, I do think that medications are a good tool in treating acute depression. But the idea that I have is whenever I see someone on antidepressants is, how are we going to get you off of these? What are we going to do to get you off of these, right?
I love that.
And then, do you have treatments for depression in Neurovella?
Well, I mean, what I said, neurofeedback,
There you go,
meditation, breath work, vibration chair, they work. There are acute hacks. But the best thing about chronic diseases is to do quick hacks to change the path of that disease. And I think you just mentioned it perfectly. The way you put it is to change the path, because if someone's been on Zoloft for 50 years, they just feel like that's just like a vitamin to their body.
Yeah.
And it's not. These are chemicals that have incredible effects on the nervous system.
Yeah.
So I feel like if we could do that with, turmeric and vitamin supplements and vitamin D3, K2, and, lion's mane or something of that sort, like we talked about, I think that's much better than the pills that are, potentially caustic to the nervous system.
Yeah. Can we talk a little bit about supplementation? Because I know you've done a deep dive into supplementation for the brain.
Yes.
And, you mentioned lion's mane. Talk about some of the supplements that you see that, traditionally people don't even look at, but you've done some research in.
Yeah, and I have to say the biggest challenge is, and I have a disclaimer on the strength of evidence, because we've looked at class 1, class 2 evidence, and in the supplement world, it's there. For example, the evidence for folic acid around pregnancy, some of that evidence was, clear, and now it's not as clear when you look at the studies in detail, et cetera. So I feel like science is always on trial.
Right.
But we know that you need certain substrates for your bones and nerves to work well. And if you're missing those substrates, or they're not bioavailable for you due to an intestinal problem or aging, or you said
or
senescence.
genetics.
Yeah, or genetics. Then supplementing with those is an absolute must, and it's going to make a difference. So we looked into lion's mane, we looked into bacopa, we looked at for clarity, for focus, for memory, and we saw some of the evidence that were in the scientific articles. Again, I wouldn't call it class 1 evidence, but the anecdotes were strong, as well as some case series. And then we added things like acetylcholine, CoQ8, B6 and B12, as well as magnesium threonate that I know you guys offer as well, which is very, very good. And we put them all in a packet called Axon. We called it Axon for myelin sheath or myelin health. And it's worked well for my patients. And we're doing a trial. It's very difficult to do good nutrition studies. Yeah. I mean, it is almost impossible to design it so perfectly and eliminate all other variables so you can prove that tiny hack worked. So being a purist, I don't know if we'll have a great answer, but to deprive people of a substrate that is of no major complications, no major risk, is giving them energy and possibly could give them clarity, focus, memory, et cetera, is a no-brainer.
Yeah, exactly. And, you mentioned lion's mane, and I look at some of the other ingredients as being like nutrients for the brain, but also some that have some roots even in like Ayurveda and ancient Chinese medicine as being treatments for depression, for example. And so there's a lot of historical context here for some of these herbal remedies, et cetera, mushrooms,
Indeed.
and been used for centuries now in ancient medicine traditions too.
I mean, I'm still amazed by the data on turmeric because it wasn't known to us when we were in medical school, right?
Right.
Like no one said.
My mom knew.
Yeah, exactly. Exactly.
You know, my mom, like,
Exactly.
I'm Indian origin. We
Yes.
use turmeric for everything.
Everything. And there's now some evidence on saffron.
Yeah.
Which is a Persian spice.
Very good. Yeah. I love saffron.
Yeah. And there is some new evidence that it has incredible brain and antidepressant activity. So they're seeing some evidence on that. And then, things like membrane stabilizers like phosphatidylserine and acetylcholine and things of that sort. Those are no-brainers. But the strength of evidence and also figuring out the physiology of how something becomes bioavailable, I think we'll have a lot more information because you're dealing with a pH of 2 in the stomach and the coating goes away, and then where in that duodenal curve, where's all the absorption and the enzymatic processes leading, and then B12 itself has quite a long journey through the intestine. So I've definitely seen some great results with supplementation. But I'll be the first one to say the disclaimer is we need class 1 evidence.
Yeah.
And we're after it.
And to your point, though, these studies are hard to do because everyone has a different physiological state that they're starting from. And then you're taking these supplements and, you're not just taking them in a vacuum. Like, unless you're in a metabolic wards where you're controlling for everything, you're living your life, right?
Yes.
And so it's hard to know. And so I'm a big believer also in N of 1 for something that is not harmful and a good quality, seeing how it works for you.
Love that.
I will say you gave me some Axon right before this podcast.
Yes.
And I do feel like I've had some smart questions for you. So
That's great.
I feel like it does help.
We're proving it. N of 1.
N of 1, right.
Proof's in the pudding.
Exactly.
Yeah.
But, on the depression front, I know at your brain spa, you use biofeedback.
Yep.
And so is there a particular protocol for depression? Could you talk about that? Yep.
Yes. So to get a brain into a resting state and able to sort of unlearn a habit is like the biggest challenge.
Yes.
And there's studies on the default mode network, for example, about how to oscillate, how it oscillates between being overactive and underactive in certain states. It's a very essential part of our self-referential system, the part of the brain that gives you the concept of self. And that part is what needs to be better biohacked in depression. And that's what we're working on with our neurofeedback protocol.
Got it. Okay.
The simplest way to think about it is oscillating between deep focus and complete detachment. And the way I look at that protocol, that's what we're working on, is the brain needs to ride the bicycle. If you push too hard, you'll fall. But if you can maintain that balance between cognitive control, which is your executive control, and your default mode, which is a self-referential rumination, then you're riding what we call the Neurovella octave. And I think that's going to be very exciting when we protocolize that in a way that we can visualize it. Because right now, you have to sit in a very expensive MRI machine, get a resting state, have some treatment, go sit into the machine again. So it's not as live, and we will have better tools. And right now it's brainwaves give us the tools, but it'll be much less intense as the technology gets better.
So cool. That's so much amazing stuff coming,
Yes.
Yeah, I think, to your point, that balance, that not too much and not too little, and oscillation, kind of like riding a bike. When you're riding a bike, like you're going in a straight line without falling. It's great. But you don't know when it comes to the brain without the neurofeedback. So to have that feedback mechanism that you're developing, I think it can be so powerful because you could train your brain to how to stay there, right?
Exactly.
Right? And so then this can treat...
And it learns.
Right.
And it's somehow, that's the part I find fascinating. I'm like, would Freud have called this a subconscious drive? We don't even know because it's not conscious and intentional, but that your brain has undergone a learning experience. Just like you learn information in medical school, some of it was very intentional and some of it was simply being in an environment and it just got in you.
Yeah.
And I find that fascinating. It's like learning by osmosis or something like that. And I think our brain is a very smart tool that we have yet to uncover all its potential. And because of what we're undergoing with AI and all the other sort of fears around us, and the rampant stress, anxiety that we see around us, I feel like we absolutely need to have a cognitive fitness protocol, a self-care ritual. It's something that says, you know what? I'm going to take care of my physical body, but I'm also going to take care of my brain as an organ, my mental health, because it's the key to happiness. There's no health without brain health.
Yeah, incredible. And so true. And finally, having some of these tools that we can use to foster this and promote this, I think is critical. Man, we talk about so much incredible stuff today, but I feel like we've only scratched the surface of how deep of a dive we can do.
Yes.
So you have to come back again.
I'd be honored. I'd be absolutely honored. I think we did this a few years back.
Yeah, we
before
did.
Next Health was this Next Health, which huge congratulations to you for doing what you have set out to do, which is to make an amazing network.
Thank you.
Of places where people can go and actually better their health.
Yeah, and thank you. I learned so much from you over the years, and thank you so much for doing all the things that you're doing, and look forward to doing so much more with you in the future. We did our first podcast together. I think it was during COVID.
Yes,
when
it was.
that happened, right?
It was,
and we had just met, and now look, here we are.
Yes,
Here we are.
And I think thanks to people like you, I think healthcare is going to be taken back by physicians who want to control, because we're the ones that have the biggest stake in people's well-being. We care, and not to say anything bad about United Healthcare, but but I feel like we have agency on the side of improving people's lives, and I think that's what I'm really excited about.
Yeah. I feel like everything that we're doing here at Next Health and what you're doing at the Brain Spa, like we're creating a new healthcare system that is really trying to promote health and prevent chronic disease and help people feel great. And it's a different system that our original system was never built to do. Original system was built to, treat infections
Eliminate
with
disease
antibiotics.
after they happen.
Exactly, right. If you get hit by a bus, you need the hospital for sure.
Exactly.
Don't go to the brain spa. But before that, everything else, the treatment is, make sure that you're taking care of your overall physiology and brain physiology.
You just triggered something that I have to come up with.
Please.
So, my brother is a dentist.
Yes.
And we always make this analogy to spine surgery that I always tell my patients, if your spine was like teeth, we would just clean it every 6 months and you would never need spine surgery. We would just clean the spurs and make the discs, a little better. The analogy to the brain is we don't have a place where we do a brain cleaning. We do it in sleep, but some people get bad sleep. So the Brain Spa, the goal of Neurovella is to create a space by which you get a little brain cleaning, a little at a time, to prevent a chronic disease.
Yeah, I love
Just
that.
like Next Health.
Yeah, exactly. It's fantastic. Yeah, and you have to do it. You have to keep doing it. It's not a one-time thing, right? Just like brushing your teeth is not a one-time thing. Cleaning your brain needs to be done every day. You need to have a professional do it for you, like you go to the dentist to get your teeth cleaned by a professional.
Yeah, well, you can do it yourself. You can do it at home.
Yeah.
You come to the spa to have a more intense cleaning.
Exactly, right.
Just like a great analogy to dentistry.
No, that is a great analogy. Well, we're definitely going to have another conversation, hopefully
Really
in the next
appreciate
few
it.
months as well. But how can people find you and learn more from you?
Yeah, so I'm at Dr. Vookshoor, DrVokshoor on social media. We're at neurovella.com. We're at the inifoundation.org. This is a nonprofit research institute. And my neurosurgery practice is nsg-la.com. Thank you so much.
Thank you.
Yeah, it's been such a pleasure.
This was a great,
Long time coming.
great episode. Thank you.
Thank you.